let's end on your oral care routine. So we'll start with you waking up.
This is where I'm
Head
going
to
to
the
lose my license
bathroom.
if people hear what I do.
Let's talk about what you do to start the day and then move right through.
So, yes, we talked about the two most important things: diet, nasal breathing, not breathing through your mouth. But when it comes to like my oral care routine, I wake up, I do brush my teeth with an electric toothbrush in the morning, just with water, and I'll explain why. But let me just go throughout the day, and then we'll come back around to the morning. Throughout the day, I don't do anything in particular. No, just make it verifying. Like if I got something stuck in my teeth, I'd floss it out. But like, there's nothing I'm doing on a daily basis. Before I go to bed, I brush my teeth with an electric toothbrush. I have recently I've used different brands. I recommend a hydroxyapatite toothpaste. I use Risewell because they have micro hydroxyapatite, and it's a huge rabbit hole. But there's nano hydroxyapatite is another kind of hydroxyapatite, uh, which is probably safe, definitely effective. I'm not 100% sold on the nano yet. Once I am, I'll probably just be like, yeah, everyone should be using nano hydroxyapatite. I'm not sold on the nano. I think there's potential issues. I'm 95% sure that it's probably fine. 5% of me still is like, hey, I don't need anything special. So hydroxyapatite is going to be the substance to remineralize teeth. So if you had some demineralization of your teeth, whether from your diet or mouth breathing, this is going to help kind of fortify your teeth at the end of the day. Fluoride is what's traditionally used. I don't recommend fluoride. Definitely don't recommend fluoridated water. That's a massive discussion. But if you're pregnant or have children, I would filter the fluoride out of your water. That's with the par for the course. If you're using a toothpaste and you're an adult and you're spitting it out, I'm less concerned. But I still would just go with hydroxyapatite anyways because it's safer. So mine is I've been using Risewell. It's a good quality brand, legit ingredients. They have micro nano hydroxyapatite. They also have nano, so you could choose if you want. Nano is probably more effective if you need that more effective because their smaller particles are going to fill basically in the holes of your teeth better. I don't feel like I need that, so I like why risk it if you don't need it. I probably don't even need the toothpaste at all, but I do use some toothpaste. I use floss that is PFA free. That's the one thing you want to sure if I do recommend flossing. Like why not clean out in between your teeth? But floss is like the glide. What makes it glide? Like Teflon, PFA, polyfluoroalkyl substances. Floss with PFAs, is it the end of the world? Probably not. But PFAs are like ubiquitous in your life, so why not get rid of them where you can and just choose a floss that's PFA free? And there's a lot of flosses have been phasing it out because I guess awareness is growing around PFAs, which is great. That's the extent of it. I don't use mouthwash. I don't chew gum. I know a lot of people are on this xylitol, which can be fine. The therapeutic dose of xylitol chewing gum is extremely high, so you have to be chewing xylitol all the time. I know xylitol, if I consume it like as an artificial sweetener, so disturbing to my gut, and it is for many other people too. So it's not something I would swallow a lot of, but it can be okay. It seems to be beneficial as far as how it interacts with the oral microbiome. So it seems to be a positive there, but I don't think it's necessary. I mean, I'd focus on the major things that we talked about: is diet, not mouth breathing, some of these basic oral care like electric toothbrush I recommend because manual toothbrush with hard bristles and bad technique can cause recession and things like that. So electric toothbrush gets rid of a lot of the user error. And the last thing I wanted to conclude with, I was like, well, after I brush my teeth at night, I go to bed, I wake up the next morning. All I've been doing is breathing through my nose all night. So it's not like, I know a lot of people are like, what, brush your teeth like with toothpaste in the morning. I don't, there's no demineralization that was happening. So it makes no sense beyond just like, hey, let me just get like the saliva production, rinse everything out and go. So, it's pretty basic oral hygiene.
And how do you know you're breathing through your nose throughout the night?
There's a few ways you can. So if you wake up, it's better to, like, it's almost more clear, like when you know you're not. If you have to sleep with water by your bedside, clear sign you're breathing through your mouth. If you wake up with a dry mouth, likely breathing through your mouth. Snoring can or cannot. So you can snore with your mouth closed, you can snore with your mouth open. So that's not a true sign, but there's some other warning signs like those are three kind of the classic ones. But the last one, like a bedtime partner. saying like, hey, yeah, your jaw is hanging open.
If you enjoyed that clip, you're going to want to head over here and catch a full episode. I'll see you over there.
If we take those 300,000 years, we put them on a 24-hour clock. The first 23 hours, we don't see cavities in the fossil record. We don't see periodontal disease in the fossil record. We don't see malocclusion in the fossil record. We don't really see abscesses in the fossil record. But something happens 1 hour.